I had been injured on duty in September of 20, and almost 2 years to the day after a couple of back surgeries, I had been medically retired. And then I had to go one more year for a workers' comp case. So during those 3 years, I had no purpose. I couldn't work, couldn't volunteer, wasn't allowed to go to the gym, built one in my house, but essentially I was just a man without a purpose.
One of the guys who had come in with the pellets, and his white count was elevated too. So I treated him for an infection because the body was definitely rejecting the pellets. So is it something in the pellet, or they just got an infection that was just kind of transiently hanging around?
A lot of marriages have died because of no intimate relations.
True.
And this is going to get these guys back in the game who are out of it. It's a physical issue. There's nothing wrong with you. You're just going through changes, and you can correct them easily by doing this. I feel so bad. I look back 20, 30 years ago when this wasn't available, and you saw these guys like in their 50s and 60s, and they should still be living quality lives, but I can't even imagine, like, if this medicine wasn't around for me right now, like, how would I feel?
Oh, shot fired, officer down, shot fired, officer down. Got a city officer down, shot fired.
223, be advised, we have a visual on enemy paratroopers at grid Papa uniforms.
Welcome to the Resilient Warrior Nation, a podcast dedicated to inspiring hope and healing for first responders, military veterans, and anyone facing PTSD and trauma.
Hey guys, welcome to another podcast episode of the Resilient Warrior Nation. I'm your host, Mike Morgan. Very excited for my next guest. But as I usually do at the beginning of every podcast, I like to explain why I wear the shirt. It is not a proclamation. Unafraid is the name of a company owned by a man named Eddie Penny. Eddie actually changed the entire trajectory of my life in the spring of 2023 when I sat down and watched a podcast episode of The Sean Ryan Show in which Eddie was a guest. Eddie's a former Navy SEAL, Team 6 guy, Devereaux guy, and as he spoke, he talked about the Extortion 17 incident in which a Chinook was shot down in Afghanistan by insurgents, killing all 38 aboard. This included 17 SEALs. It was the largest loss of community in one event ever, and included in the dead was Jason Workman, Eddie's best friend. As Eddie recounted the story of escorting Jason's body back to his hometown in Utah, and then finally to his final resting place at Arlington National Cemetery, he was visibly upset, recounting the story, rightly so. And I simultaneously began thinking about a call that I had buried, that I had had 5 years before. I am a 30-year retired, medically retired police officer, and that call consisted of a 2-year-old found floating in the pool, a beautiful little girl named Dana Sikorsky. She survived the incident, thank God. But it was literally the one call in my 30-year career that I had started to cry, stop myself, because men don't cry. And as I listened to Eddie tell his story and thought about Dana, I began weeping like a baby, no other way to say it. I had been experiencing feelings of anger, rage, depression over probably the year prior leading up to this. I had been injured on duty in September of 20, and almost 2 years to the day after a couple of back surgeries, I had been medically retired. And then I had to go one more year for a workers' comp case. So during those 3 years, I had no purpose. I couldn't work, couldn't volunteer, wasn't allowed to go to the gym, built one in my house, but essentially I was just a man without a purpose. And idle hands are the devil's work. I had a lot of time to think. And as I'm going through this episode of crying, I quickly realized that what was going on with me and had been going on with me was that I had suffered some sort of PTSD during the course of my career. I always mistakenly believed that PTSD was only caused by seeing your brother or sister next to you get killed, but mine was caused from being inside the most devastatingly intimate moments of other people's lives for 30 years. So I knew I needed help. I wasn't sure how I was going to go about it at that time. I didn't think I'd speak to a man or woman sitting behind a desk in a traditional counseling setting, and they were going to be able to help me after telling what I've done and the things I've seen. So I had been hearing these special force operators on both Sean Ryan's podcast and others speak about their healing journeys using psychedelics. They were coming back from war, self-professed broken men, and these men were healing using these psychedelics. So I really started paying attention and decided that ayahuasca was calling me. Myself and my wife went to a facility last March 1st of 2024 in Orlando, Florida, called Soul Quest Ayahuasca Church. And during the course of that weekend, I literally changed the entire trajectory of my life. I felt like I was reborn in a non-religious sense. And as I was coming out of that first journey, the universe and I would speak, and I know it sounds weird, but the universe told me that I was healed, and my life's purpose was to go forth and help other first responders and vets heal their PTSD and trauma issues. And I literally said it, okay, out loud. I wasn't sure how I was going to implement it, but I accepted that. And one thing I decided to do was to create a podcast, much like Sean Ryan's, to do for others what Sean Ryan's did for me. And in that, I bring on ordinary people who've done extraordinary things with their lives. They speak about the highest of highs, lowest of lows. My guest today is a clinician. So Judi is going to tell us all about the medical side of things. And with that, let me introduce my next guest. I'm very excited to introduce Judi Casey. Judith is a board-certified nurse practitioner. She and her husband, Tom, co-founded Cutting Edge Testosterone Therapy, LLC, in Manchester, New Hampshire, and Wells, Maine. And Judi is also the medical director. Her practice focuses on advanced medical solutions, including anti-aging treatments, peptide therapy, medical weight loss, testosterone replacement therapy, and hormone therapies for women. Judith earned her Master of Science degree from Walden University in Minneapolis, Minnesota. She is a board-certified adult gerontology nurse practitioner, specializing in care for adults at all stages of life. She achieved her board certification through the American Nurses Credentialing Center and completed a one-year fellowship to enhance her clinical expertise. With years of experience as a primary care provider and transitional care unit specialist, Judith emphasizes personalized hormone-optimized healthcare. Her goal is to improve and maximize the health and wellness of both men and women through innovative hormone and peptide therapies. She values one-on-one patient relationships, providing tailored care without binding contracts, and is licensed to practice throughout New England and across the United States. Judith is dedicated to helping her patients achieve peak health and vitality through customized, evidence-based treatments. Judith is married and is a mother of 3 children. She considers her English Mastiff Gunner her 4th child. He is a big boy. Much of her spare time is spent at the beach or gym, and she also enjoys cooking for her family. Judith, welcome to the podcast. I'm honored to have you on. And just for transparency's sake, and as you guys know, Cutting Edge TRT is my first sponsor. I am super pumped. I think our missions align well. And most of the men that are watching my podcast, frankly, need this hormone therapy because these professions that we find ourselves in destroy our cortisol and testosterone levels. And it's mandatory. It's not even, some type of privilege to enter into these hormone therapies. So we're going to talk about it in depth with Judi. Judi, welcome to the podcast. It's an honor to have you on.
Well, thank you so much. Wow, that was a great introduction. I'm lost for words.
I'm going to, wherever you go now for the next month or so, I'm going to introduce you to everyone we meet. So
appreciate it.
Absolutely.
No, hormone therapy, it's interesting because when I did primary care, I was probably one of the few that would order testosterone levels for my patients. When I would do physicals, men would come in and they're just kind of course, I don't know if it's because I'm a female. I'm like, yeah, I know I'm a female, but I know some things medically, but I also live with a man. So it's important. And, we'd go through the usual physical exam, whatever, and I'd be like, how things going at home, blah, blah, blah. And they'd be like, well, how's your libido? How's your this? Or how are you working out? And they're like, we shrink into the chair. And they're like, well, no one's ever asked me that before. I'm like, well, it's part of life, right? It's very important. It's basically we're human beings, and that physical connection we have with someone else is very important. As a woman growing up, you're always taught men are these divine individuals, and all they think about is sex, right?
Food and sports as well, but yeah, predominantly.
But when you sit on the other side of the chair, and literally I've seen thousands of men before me, which sounds funny when I say that, but
It's true. I look up.
you have these conversations and you realize that men are like crying inside to have these conversations because they're like, my wife thinks I'm cheating on her, or my girlfriend thinks I'm cheating on her because I just don't want to be intimate, or I just don't feel like doing anything. And I'm like, well, buddy, your testosterone's low. I'm like, for most men, I don't want to say it's a quick fix, but it can be a fix or an improvement in the right direction. it's rare that someone doesn't improve. You know, we treat a lot of veterans. We've treated a lot of first responders. You know, there are some underlying issues. And like you mentioned earlier with PTSD, whether it's PTSD from serving, you know, in war or being on the front line. And I mean, just working in COVID, you know, I mean, everybody has their exposure during that time, and it was pretty severe, people dying left and right, you know, and you're supposed to save people, and you can't all the time. So that can harvest a lot of things and just kind of keep it back there. But yeah, and then, you know, firefighters are going out, you know, seeing young babies or children, or, you know, there's always something that people are exposed to, but we just get taught to kind of just brush it aside and just keep moving forward. But over time, that has an effect on the endocrine system, right? That cortisol that causes the body to respond so that you have that flight or fight response. But after a while, your body burns out, you know, then it has an impact on your hormones.
And how soon can that be? Because we're talking about, you know, I'm sitting here talking about my career with 30 years. So, you know, maybe mentally thinking, oh, you know, it takes a lot of years for that to, for these things to kind of break down your body, but it doesn't take that long, right? You don't have to be exposed to that much stress for these things to start significantly affecting you, correct?
No, and I also think, you know, to kind of put time constraints on, or restraints, however you want to word it, it's going to vary by person, right? Because what your tolerance level, or maybe when, you know, if we talk about, say, yourself, you know, when you were first started out as in law enforcement, you know, you were younger, obviously, you know, your testosterone levels are higher. So over time, as your testosterone levels are decreasing, your tolerance is decreasing. Your ability to respond back has decreased. And then at the end, you know, maybe not saying that that situation wouldn't have bothered you, but maybe you would have handled it differently if you were 25 years old.
Right.
So, but then you've got guys coming in from the military, you know, who are overseas and tours, you know, and they're going off 18-year-old kids. I mean, let's face it, they're kids, and they're coming back 28 years old, and they've just seen so much. So I think it's the exposure, how long you're exposed to, you know, are these guys where their levels higher, the testosterone levels, or it's just that chronic exposure, no time in between to recover. So there's a lot of variables, you know. So again, because I don't like to just treat people and put everybody in the same box. I just think it varies person to person, in how in the support you're getting or not getting,
right?
You know. And at some point, I think people just boil over and just had enough. We wonder why people snap. I mean, you can only tolerate so much for so long.
Yeah,
So,
it's a saturation point for everyone, for sure. And
exactly.
you know, I think it's difficult for a lot of us to speak about these things. Like what brought me to testosterone therapy, and it was almost in its infancy. It's probably going back to like 2014. So what was I, about 44, you know, mid 40s at the time. And, you know, I noticed that my libido like tanked. And listen, let's face facts. It's a little embarrassing me talking, you know, I had a male doctor.
Yeah.
He was very cool. So it wasn't that difficult, but you know, it's still a tough subject to broach for many guys at first. And, you know, number one, you think you're all alone because you're not usually talking about this with your boys.
Yeah.
Everyone's so embarrassed. Everyone's going through the same thing, but no one talks about it. It's incredible, you know, on so many levels, so many different things, not just this. But yeah, when I finally brought it up, I'm like, Doc, you know, I don't want to be having sex until I die. I'm mid 40s, man. How is this happening already?
Right.
And we did the test, and I think I was around probably upper 2s, maybe low 3s, which is quite low.
Yep.
And it was corrected fairly quickly, and it kind of blew me away. You know, how much better I was feeling mentally, in addition to the libido. Like the energy level was back. You know, I just felt like a younger man, and I had been training like throughout. So it wasn't like I wasn't going to the gym. It wasn't like I was not eating well, but you know, the hormone levels are another animal entirely.
Yeah. Well, and that's the thing. We're seeing guys younger. I mean, I feel like I see a lot of guys in their mid to late 20s. Common denominator seems to be law enforcement, firefighters,
Yep,
veterans. So again, it goes back to that that fight or flight continuous. But again, depending on the person's age when they're coming in, we're labs, and you mentioned your doctor doing labs. That's so important because it gives you a baseline, and there are ranges, but ranges are for everybody. And I jokingly will say, your 19-year-old son and your 50-year-old father are in the same range. You're expected, like, if your testosterone levels are both 400, it's like, how can that be?
Yeah.
Right? Whether you're 19 or you're 90, you're all supposed to. So, and it's an arbitrary number that's assigned by the American Neurological Association that says under 300 is considered low. Well,
Okay.
again, that range, whether you're 19, 90, you're in shape, out of shape, short, tall, fat, in between, sick, not sick, whatever, healthy, unhealthy, you're all in the same range. So, and then there's information coming out too saying that, when we start going back, the testosterone levels for men are decreasing, like your ranges. Like if the guys nowadays were compared to, like, say, even the 80s and then to the 60s, the man's normal level now is less than it was, like, if you took a 50-year-old to a 50-year-old back then, or a lot lower.
Why?
So,
Sedentary lifestyles that we're leading for the most part?
yeah, there's a lot of factors, right? So, we look at, we have more people on medications, I don't want to get too political, but we talk about foods,
Oh, food.
It-
With Sarah Paulson, it's unbelievable. If you really research it, it's disgusting what our food supply consists of.
Yeah, I mean, they're showing that certain food colorings are, they affect the estrogen receptors. Estrogen, well, if you got too much estrogen, you could be whiny, you gain weight, there's a lot of different factors. I mean, it's great having all this technology, but we could be sitting here and not even move, right? You need food, you need, well, maybe not water, you'd have to get up, go get that, but
Yep.
people who get all these things, you can just put your TV on, you don't have to get up. I mean, you probably grew up, your father said, hey, when you're up, go change the TV.
Yeah, exactly. I was the remote control.
Yeah, exactly. No, I didn't want that station. Go back.
Yeah, exactly. Kids will never know. Kids today will never know the sacrifice.
Yeah, so there's a lot of different reasons. Because I've just been keeping a mental note, and again, this is nothing scientific. Someone might say, "Oh, I don't know what she's talking," but if I look at and it goes back to then, if we're comparing back to the 80s and the 60s, but guys 45 and older, if we compare it to the under 45 group, and again, this is just my observation, the 45-year-old group might have like a 400 to 500 testosterone level, but they're symptomatic of the guy who might be 30 years old who has a 300, and they're having the same symptoms because you've held your levels longer, but yet you're still having the same symptoms, and so that's why numbers aren't important, right?
Okay.
Because if you back when you were 25 maybe ran a 1200, now these guys who are 25, I've not seen any guy come in under 30 with a testosterone level over 800.
Really?
It's crazy.
Wow. And these are just civilians as well. It's not just these first responder and military
No, just in
professions. That's amazing. Now, look, would you recommend that, say young kids watch this, 23 years old, that they go in and just get the baseline check now? This way they have it for the rest of their lives to compare it to?
Yeah, and again, depending on the age of like sometimes we get 20, 21-year-olds, and I'm like, it's kind of young. They might, if they say, well, I'm in the military, then you got a different background, right? But then I'm thinking, well, you're still under usually they're still under their parents' insurance, so I'll give them a list of what they should go get checked. Okay. Because there are reasons that, and it's rare, but there's a pituitary tumor that could occur that could stop or have an effect on hormones and having low testosterone. I haven't had one yet, but again, it's still doing the due diligence that if you got a 22-year-old calling saying, hey, go ask your PCP to do these labs, look at your testicular function, your luteinizing hormone, your follicular stimulating hormone, ask for your total T, your free T, SHBG, estradiol. Anyways, as for those,
She doesn't have experience in this field.
and if things are super off, then the next step is to have them do an MRI, make sure you don't have, they're usually benign pituitary tumors, but, again, if I haven't seen it yet, but it's, someone's going to have it. You never know.
Right.
And if you're super low and your numbers are everything else is normal, then come back and see me, but
Now,
there
are like young guys like this come in with low libidos, like they're suffering these types of conditions at young
I've
ages?
had a couple, I don't, again, I'll, try to be general when I want it, but let's just say in their 20s with what may have had testicular cancer. So he had one testicle. So imagine being in your 20s, one testicle, low testosterone, and being told, I'm like, come on. Like that, I'd be telling like a woman, you have one boob and, you got 3 kids to feed.
Oh, yeah.
You're on your own. Like, go, you don't have no help. I mean, it's not the same, but you get the picture.
Yeah.
This poor kid, he's young and he's got low T. It's like, well, what's wrong with this picture? We helped him, of course.
And you'll see providers that are like turning down treatment because they're so.
Yeah. Or they just say, well, your number's in range.
Wow.
Well, I'm sorry, but if you're a 20-something-year-old with a 200 and let's call it 280 for a testosterone level, no, that's not acceptable.
I'll tell you, nothing surprises me anymore because my mom's best friend had been going through pancreatic cancer. She's since passed, but she was having bad side effects from chemo. And one thing she noticed was number one, the painkillers were stopping her pain, but she had to have a decent sized dosage. This oncologist, he was terminal.
Yeah.
This oncologist was refusing to give her more painkillers because he didn't want her to get addicted. I was blown away that someone could have that thought process. She's going to die. I don't care if she's taking 100 a day, if it's getting her out of her pain. What would you care? And then even make matters worse, her grandson gets her, smokes weed with her one day, and she realizes that, number one, it stimulates her appetite. Number two, the pain goes away again. So she gets a medical marijuana card, but this guy refused to provide it for her. This is an oncologist. It blew me away. Like, what are you, God? Don't you care about these patients?
And that's the thing. And that medical marijuana, I mean, we do med evaluations for like our New Hampshire patients, but yeah, for a while you used to have a 3-month relationship with your provider before you could even do the thing. And, through my rotations, one of them was with she did palliative care. And this one lady, she had rectal cancer and she didn't have 3 months to live, and it's like, by the time she would have got her card, she would have been dead. It's like,
right.
But thankfully they changed that because I'm like, well, what's the point?
Yeah, exactly. They're going to die. I mean,
because it
helps.
It helps with nausea. I know we're kind of going off topic, but helps with nausea. What people have said to me is it kind of takes your mind off the pain. It's like, is it really taking away the pain, or you just take your mind off? And then it helps people to eat so they can sustain. They can have some type of decency. It's like, oh,
absolutely.
Don't give up on them.
Yeah. Yeah. I mean, I from my perspective, you should be advocating for anything that helps them, short of something that's illegal, and all these things are legal. So what is what's the problem? But I don't know. I have a problem with it. Doctor's morality gets involved with someone else's treatment, kind of interferes with it. But that's me and my soapbox, I guess.
Well, yeah, the same soapbox. So where were we? Oh yeah,
exactly.
Yeah. So that's like the younger group, but then obviously labs are important. So whether anybody coming to our facility, we're getting labs. Some people already have their labs, and if they have them, we'll take a quick peek to make sure you have everything that we need. If you do, that's great. That makes the process a little bit smoother. Okay. And then the appointment's scheduled with me, and then we're going to go over your labs. Then we're going to talk about the pros and cons. Again, it comes down, and that's where we look at, what's your total testosterone? What's your pre-T? What's that SHBG? And SHBG is a protein that binds, kind of eats up some of that free T. So you could have a guy who comes in with, say, a 600 total testosterone level, which some people would be like, well, that's pretty good. Well, it depends, right? Depends what you're used to. But then if we look at what that SHBG is versus the free T, a lot of times, and again, this is just repetition of what I've seen, if that ratio is like a 1-to-1, maybe even a 2-to-1, that means that a lot of the free T is being eaten up or being bound, so there's not a lot left over for the other receptors in the body. So that's going to create the symptoms. So that's why those three numbers are important. Now, you could have a guy who comes in with, say, a 300. Well, that's kind of a no-brainer. It's kind of, he's on the low end anyways.
Right.
It's a poor guy who comes in with the 1-to-1 ratio and under 300 testosterone. That poor guy needs test fast.
Yeah. Stat.
Yeah. But the flip side of that is, if that's occurring, that person is going to have a quicker response because their body is waiting for it. It's like, okay, you're going to get your injection, because we go that route too. We walk you through an injection the first time you're in the office, so you know how to inject, where to inject, how much to inject. And those people with those, low free T, low numbers, may feel some transient improvements within a week or two. Well, maybe last the whole week, but again, there's some light at the end of the tunnel.
Okay.
So.
Now, are there various delivery methods that you recommend, such like cream or the pellets? Can you just tell us what is the advantages and disadvantages of one to the other?
Yeah. So the routes available, you basically have your pellets, your cream or your gel, your injection, and there is an oral now that's out. The older orals.
Oral test?
What's oral test? Correct.
Oh, I didn't even realize. Okay.
Yeah. So the older ones were more likely to have some negativity to the liver, but the new ones are impacted or absorbed more readily through the lymphatic system. So not so much issue with the liver.
Okay.
So the upside is that you don't have to inject. You don't have to worry about transference if you're using a cream or a gel. The downside is you have to take it every day, twice a day. Okay, so there's that.
Yeah.
I find the oral is good for the person who doesn't want to inject. Maybe he's never tried testosterone before. So say they get a 200-300 level, and maybe now their testosterone level might hit 700-800.
Okay.
So they don't know what it's really like to be on the injectable and know what it's like to maybe hit 1,000. But it works well for them. They feel good. Their goals are achieved. There's a resolution of their symptoms, problem solved. But it's an option. The creams or gels. Again, with the number of patients that we have or clients that we have very few that are on that deliverance. Just because, one of the biggest one is you got to be careful of transference to a significant other, pet, child, that sort of thing. And it's not like if you don't apply it, 3 hours later, you'll be fine. But it's all of a sudden you put it on and then your animal jumps on you or whatever, which I can only imagine if that were us. Gunner would be 400 pounds. But
Throwing up 605 on a bench.
Yeah, exactly. There's a horse living in that house. So there's that. And then the people who do it do okay. I have probably more women on it, which works well for them.
Is that related that women to be on test?
Yeah, women can be on test. They do extremely well. And that we can have a conversation about that too if you want.
Yeah, we'll have to touch base on that too.
Yeah.
There are women watching this that I'm sure are curious.
Oh yeah. And yeah, so creams or gels, if we do anything that's cream, it absorbs better. There's, less breakdown of the skin, but again, not a huge way to offer it. I do offer it just again for the person primarily doesn't want to inject.
Okay.
I have not brought pellets into our practice yet. I know people get pellets. I'm not 100% there as a provider. Every person who had pellets who has transferred to me said the same thing. I felt great after I got the pellets, but within 3 to 6 weeks before my next appointment, I felt like I did when I started. So for me, it's just an exaggeration of that injection, right? You inject on day 1, you peak 3.5 days later, and then you get your little trough.
Right.
I've had people, and actually a couple of women who had the pellets who, when they had their labs done through the provider who did their pellets, their testosterone levels showed elevated, but their free T was really low. So everything was being bound up. So, and I'm thinking maybe, again, and I'd have to dig deeper into that. So this particular person, what I did, because she's like, I feel like crap. And I'm like, I believe you,
Yep.
based on labs, people be like, oh, well, things are where there should be. Well, they weren't. Again, going back to that free T, that was a huge, huge factor. So what I did is I titrated her dose of testosterone. We started low, dosed twice a week, so it would boost her free T.
Okay.
But it wasn't quite, it's going to have some impact on her total T, but not a huge amount because we're going really low. But it was giving her that boost that she wasn't getting from the pellets anymore. As her pellets are wearing off, we're boosting up her dose.
Okay.
She feels great.
And then she came off the pellets after that, I'm assuming.
Yeah, pellets are.
Okay.
Yeah.
Yeah.
So that's why, again, with the pellets, I've had guys come in who said they had infections after. Not much makes me squirm. One of them said he goes every month, one would pop out.
Really?
It's just that alone was like, oh. So
yeah.
with that guy, I think one of the guys who had come in with the pellets and his white count was elevated too. So I treated him for an infection because the body was definitely rejecting the pellets. So is it something in the pellet or they just got an infection that was just kind of transiently hanging around? So
how were they delivered into your body?
How are they delivered?
Yeah, the pellets.
So you basically, it's an incision, usually like on the back side, like right around your hip. And they're inserted. They look like little pieces of rice. That'd be the.
Oh, yeah, little grains of rice.
And you stick them in there, and then you basically close up the incision, and the body breaks them down. But again, it's like you got to get the right dose. The other problem I had with that was, well, what if you overshoot? In other words, what if you give someone too much testosterone in their pellets? We know testosterone increases red blood cell production, which sometimes boosts your hemoglobin and hematocrit numbers. If those get too high, your blood is thick, that's where people are at risk for clots. Yep. So now you have pellets in you, you can't take them out.
Oh, okay. Yeah, I guess once they're in, they're kind of going throughout the body.
Yeah, and some people say when they're working out, like say you're doing a leg press, they could feel it kind of.
Really? Wow. That's crazy. Why would a guy opt for this treatment as opposed to injecting? He just doesn't like needles?
Maybe it's their first time. I think they thought. I think people are thinking, well, this would be a great, easy solution, right? I just get pellets. I don't have to worry about injecting. I don't have to apply cream. I'm done for 3 months, one and done, right?
Makes sense if it's efficient. Yeah, if it's efficient.
Right. So no, because I don't know what the percentage is, but guys who come in, a lot of guys have used testosterone before, good, bad, or indifferent. So they know how to inject. They're not afraid of needles. And then some people, once you walk them through, they're like, oh, that was nothing. I think it's presentation. Pellets that are out there, people get them. There's a need for them. But again, it's, I get reps calling me all the time and I'm like, no. It took me a while to get on board with the oral testosterone. So,
I wasn't even aware that that they have. Now, what's the advantage of oral over injectables? Because isn't it a little bit harsher on your liver as well?
No. Because the oral, the newer ones, they bypass they're absorbed or broken down through the lymphatic system. So no liver issue. Yeah.
Okay.
But again, it's like if someone's like routinely taking medication or taking vitamins, like say twice a day or something, then that's probably a good fit for them because they're already in the habit of doing that. But if you've got someone who can't even take a multivitamin every day, and then you're like, well, you got to take your testosterone twice a day, every day, that can be a little bit much. So again, it just comes down to, what is the person's discipline going to be for taking that? Because because it's relying on you taking it every day, twice a day. That's how it's going to be effective.
Okay. Makes sense. And then as far as, because I've had trouble with this myself, higher estrogen levels. And like we spoke about a week and a half ago, I was kind of sad a couple of weeks ago, 2 or 3 weeks ago, and I wasn't sure why. Everything was going fairly well. And I just happened to recount a story of a buddy of mine who was telling me that he gets emotional when his estrogen goes high. And I realized I hadn't been taking my anti-estrogen. Lo and behold, I think 2 or 3, maybe like a week later, all of a sudden I woke up feeling absolutely fine. So I'm 100% positive it was attributable to that. So can you kind of just tell us the effects of, high as well as low? Because some guys just kill their estrogen as well, don't they?
Yeah.
Them?
Yeah, so some of your testosterone is going to aromatize or convert to that form of estrogen called estradiol. It's most common form in your body. So I always say, well, welcome to being a woman. So if you're starting to feel a little off, now you know how we feel. You can have a little empathy. But in all seriousness, too much estrogen in men causes like puffiness, bloating, fatigue. You can have erectile dysfunction, increases your risk for gyno, the man boobs. Right.
Yep.
So if your estradiol, and you want some estrogen because it's heart protective, it's good for your joints, it's good for your brain. But if you look at, and that's another one we look at too. So when we're looking at those labs, if you've got a guy with say a 300 for testosterone level, now the range for estrogen is 7.6 to 42.6.
Okay.
Say your estrogen is 30. So we already know that you're likely to be on the higher end, although some guys surprise me. And we're going to give you more testosterone or something to boost your testosterone level. So there's more that's going to likely aromatize or convert to that estradiol. So there's something called an aromatase inhibitor. How convenient, right? I always say this, loosely call it a blocker, because if I say blocker, people call in a panic. We're not blocking 100%. What we want to do is stop some of the conversion. And again, I like to go with the least amount of medication possible so that you don't develop new symptoms. Because why take, it's like that saying, why am I taking something for a side effect? But again, if you like how you feel at 1,000 at a testosterone level and your estrogen's at like 48 and you're having symptoms, yeah, we could try backing you down a little bit. That's one strategy. But most guys like how they feel at that point. Then we do just like, say, 0.5 milligram twice a week. Just enough to keep that level in check so that you don't have those symptoms. Because the medication, the peak or the half-life of the aromatase inhibitor is 50 hours. So what that means is it's going to take 4 to 5 days, if you will, for the medication to even come out of your system. So if you're taking just a little dose a couple times a week, it's just keeping you like rolling hills versus, like if you took it once with your shot and then you might have a little bit of a peak and then you have a trough.
Right.
I'm trying to avoid that.
Yeah. Just steady levels across the board.
Yeah.
Do you advocate for guys doing injections a couple of times a week as opposed to the one, just to avoid what you just said?
Yeah. So again, it depends on the person, right? So most guys do test cypionate. Cypionate is just that ester. It tells you it takes on average 7 days to metabolize, right? That's why most inject once a week. That peak of that medication is 3.5 days. So splitting your dose avoids that peak. Say you peak out at, I don't know, call it 4. I could use an example. Some guys peak out at 1,500, but we know their trough drops to 900 because we've tested them. That's a pretty big drop.
Yeah.
So those guys do well when we split their dose because their peak isn't as high, so don't notice quite that drop. Maybe they level out between, 10, 1100, just kind of rolling through. And then that sometimes is enough to avoid having to take the aromatase inhibitor,
Okay.
but not always.
And then if they do have to take it, do you advocate them for, specific, for instance, the day of
Yeah.
injection, you tell them?
Usually if they're injecting twice a week and they're only on that half a tab twice a week, usually with the injection, just so it avoids it going up, it just kind of controls it. If they're doing once a week injecting, which probably most guys do, because some guys have the great intention of, I'm going to try the twice a week. And then they usually come back and say, Judi, I tried, just always forget. So what's the point?
Right.
So those guys will do a half a tab with their injection and then 3 days later.
Okay.
That works well.
Makes sense.
Well,
And in addition to testosterone cypionate, are there other anabolics that you guys prescribe and, recommend? And can you tell, which ones and what they actually do for guys?
sure. So a big one is nandrolone decamate. They call it DECA. DECA. So, it's an anabolic. It gets a bad reputation because but some people, there are people that have abused it and it gets abused. But when it's used correctly, and usually a 2-to-1 ratio of test to DECA, it actually helps with decreasing inflammation, helps with joint pain. Yeah, it can help with strength and recovery. But if you think about people are taking pain medication left and right, whether it's Tylenol, Advil, or opiates or whatever, if we're able to manage pain and decrease or stop those medications, and again, they're usually if they're injecting test once a week, it's with their test, or twice a week, so it just splits it in two. It's a win-win. I talked with pharmacists on the phone. They're like, why are you prescribing test and DECA? And I explained it to them, like, these people are using, I've had, again, going back to first responders, veterans walking in my office, like curved spine, just barely getting by. And then the next thing you know, they're coming back 6 months later, like, Judi, I'm doing my MMA again or wrestling on the mat. I'm like, what?
Yeah, it's incredible.
Yeah. You're giving people back their life like they like to do. I didn't realize how big wrestling and MMA or whatever the other different branches are. How many people do that?
Yeah, jiu-jitsu has gotten huge over the past 10 to 15 years.
Good one, yeah.
Yeah, huge. And from full transparency, you started me on that protocol of DECA because I have the worst tendonitis in my right elbow that I've ever had in my life, and it's causing me so much pain. I'm waking up at night and can't sleep in comfortable positions, so it's affecting my quality of life a little bit here. I had to take off from the gym, so I'm hoping this thing's going to be, I don't want to say the miracle worker, but as advertised, because I know quite a few guys who've taken it, and they say, bro, for joint pain, it's unbeatable.
Yeah, well, so with DECA, what it does too, it's supposed to help with the collagen synthesis, so it helps with collagen. But the other thing it's supposed to do is the reason about the joint support. And again, it's various information. It's supposed to help with promoting the synovial fluid. So that's why you get that, and then you get that decrease in inflammation. It's interesting because there's information that says that DECA can suppress test levels, so it should be taken with testosterone. But what I've seen is test levels going up, which is interesting because you would think that there would be a decline. But one of the things with taking DECA, because guys, there's always concern. You guys call it DECA dick.
Okay.
Oh, he punches here.
We do.
Yeah. And so when guys are on DECA, what I typically do is increase their anastrozole by another half tab. And that usually is enough to counteract it. It's rare that I'll have somebody, no matter what we've tried, who goes on DECA that does have that problem. So I'm like, just stop the DECA, see it, because it's panic. Like, is this ever going to come back? Like, stop the DECA. And then
I want to girl got a tailspin, human ED.
okay. You'll be fine. Trust me, I've heard it a few times. It doesn't happen often, but when you hear it here and there, you know.
Right. So if you're using a ratio of 2-to-1, typically most of your guys are going to be fine. Just every now and then you're going to have one or two guys telling you this is happening, and then that's easily correctable with the AI.
Correct.
Good to go.
And then, so we usually use 2-to-1. Now, and I say usually, and I always tell my clients, be honest with me, and I'll work with you. So if guys have had an acute injury, so something that's just occurred, and they've been on, say, their 2-to-1 ratio, and they're like, they just can't get out of that funk, or that pain is terrible, then we'll go up a little bit for a short period of time until it resolves itself. Okay. So there are ways. I had a guy who had, oh God, no, I can't, it's escaping my mind. Basically, his spine was fusing together. So but he knew at certain times of the year, he would have like an exacerbation of pain where it just would flare up. So say it was October. So I'd say at the end of September, rev up your DECA, go up, from 0.5 to 0.7, run it through its course till, usually when it's done, maybe another week or two, and then go back to normal. And it worked. This poor guy would make the decision, do I play with my kids, work out, or go for a ride in my car, wherever.
Really?
And then so he got to the point he was able to control his pain. He was doing everything in a day. Nice. So it was amazing.
Oh, that's incredible. Now, in terms of therapeutic use, what is the max that you would ever prescribe of DECA? How many mgs a week for someone?
I try to stay between 100 and 150 milligrams. I'm trying to think if I've gone past that. I don't think we've needed to. Again, case by case, different person. It's a controlled substance, so obviously with pharmacies and stuff like that, regulated. But because it's compound, it's prescription, 99% of the time, that 2-to-1 ratio is more than enough.
Okay.
So, but occasionally if we've had 0.7, what's that, 140 milligrams? Yeah, probably 150, 160.
Okay.
Yep.
And then any other Anavar, right, is another?
Yeah, so we'll use Anavar, also known as oxandrolone. That's an oral. Anavar can increase red blood cell production, so they've used it for people who have anemias and that sort of thing. But what it does is it helps increase like nitric oxide, right? So it helps the muscle to stay in the anabolic state longer. So that's why it's good for muscle strength, recovery. It also utilizes fat for energy, so it breaks down body fat. We've used it for people, if there are people who come in who want to do weight loss. Well, I'm looking at them thinking, okay, again, it's personal choice. But if someone says to me, I'm like, well, how much weight you think you need to lose? And they're like, I don't know, 7-8 pounds. Okay. So let's use, they're on hormone therapy. Let's use a low dose Anavar because you're already doing all the right things. Let's just give you that boost because that's something you do cycle. It's an oral. So usually less risk. It's mild effects on the liver. And I have my own little protocol, what I do with that too. But you'll see some great results. People harden up. They get the results. Again, we've used the Anavar for healing.
Really, the healing one.
Yeah. So one of my staff members, and again, he would tell you he got misdiagnosed from a pec tear, and I said to him, like, no, I don't think that's right. I think it's XYZ. So sure enough, he went to a different. I'm like, go to a different doctor.
Yeah.
And I'm telling you, sure enough, he's like, yeah, you were right. Not why I'm talking about it, but we used Anavar, and we've used like BPC. He's on testosterone, and he's not going to have the full recovery, but he does have recovery there. So, and this was after a fact. So it's, again, when used correctly, all these things get bad reputations. Of course, like anything else, but then when you turn opiates, when you use medications for what they're made for, they do the trick.
Yeah, as you use 10, 20 times, the therapeutic doses on medicinal doses, it's going to have negative effects on there. So I don't know how anyone can expect otherwise, but it's medicine. If you use it correctly as prescribed, it's going to work effectively.
Right. And then the one thing or a couple of things I like about Anavar is that it doesn't have the estrogen. It's not going to affect your estrogen, right? So it's not going to cause bloating. So, guys, girls use it too. So it's unisex.
Yeah.
Well. People that have been on weight loss programs, they're losing a little muscle mass. Maybe they're not ready for hormone therapy yet. We might do that, use a little of this to help preserve muscle. So again, it's a great adjunct. It's one of the things that we can use. You are gonna cycle. I hate using that word, but it's what you do, cycle on and off. When people take it, I usually increase their fish oil or add it if they're not on it, just so it preserves the cholesterol, especially the good cholesterol. And then do a dim detox or something like that has a milk thistle in it that helps with protecting your liver.
Okay.
So
it truly, milk thistle it is effective? Not just the white cell right there. Okay.
Yeah. The reason we use the DIM a lot is because DIM stands for this long word that helps to metabolize your hormones in the liver, especially estrogen. So going back to when we talked about the aromatase inhibitor, some guys are on the cusp. Sometimes with split dosing and using a DIM is enough to avoid using the aromatase inhibitor. Not always, but that's another trick we've used too.
Okay.
Yeah. The DIM detox that we use from Pure Encapsulations, which we have, if you go on our website, there's a link to full script. You can get it. It has milk thistle in there, so it has the other components. So it's actually really good for the liver.
All right. Fantastic. You had mentioned BPC 157, which is a peptide. Can you tell everyone what a peptide is? Because I think people are familiar about hearing the name, but they're still not sure exactly what it is these days.
Yeah, so peptides are amino acids. Basically, they're naturally occurring in your body. So when you have peptides, they're designed to do specific things. You may have heard of growth hormone and insulin. So those are peptides. Growth hormone, it's more generalized. The dosing mechanism, or the dose basically is the control mechanism. Is growth hormone can come with a lot of side effects. So that's why if it's abused, can cause issues. But when used properly, it does the trick.
Okay.
Peptides, such as BPC 157, is designed to help heal tendon, ligament, joint, muscle, decrease inflammation. It can help with the neurons in the brain. It can help with when you're reducing inflammation, that helps with cardiovascular health. It's supposed to also help with vascular flow, so which is also beneficial for people. It can heal the gut. When they first found or came up with BPC, they isolated from the gastric juices. They were using it for bowel obstructions, which is just that, an obstruction of the bowel, or ileuses, which is a partial. So they know it heals. So we've used it for people who have had bad stomachs, a lot of acid reflux, that sort of thing.
Really?
It's done amazing. We use it for people who are going in or coming out of surgery, or maybe having a flare up of something. So there's oral, there's injectable. Nothing scientific. I've used both. Both have done well, for different reasons. So because some people are like, well, if you inject it at the site, that's going to promote healing. The way I equate that, or to help people to overcome that, if I inject insulin into my abdomen, if I inject it into the back of my arm or my leg, it hits you systemically, right? It's not just going to affect that area. Same with injecting BPC. If you inject it into your abdomen, it's going to get you systemically. So.
Okay. And I know that BPC 157 is great for inflammation, and can it actually help with muscle tears? Is it like that effective of a medication?
Yeah, I mean, if someone had it depends on the tear. If it's a micro tear, I would say yes. If someone's got it pretty, like if it's falling off the bone, like chances are you might need a little surgery there. But if it depends on what the situation is, if I can get people on BPC and TB5, thymosin beta 5, which was derived from TB4, something. That's derived. It's just and I think Joe Rogan references that as the Wolverine treatment or something like that. You got the Wolverine. I'm like, what? I'm like, oh, you mean TB5 and VTC? Yeah. So that works well together.
Okay.
Again, that's when we look at, who the patient is or the client is. If they're with us for hormone, testosterone or something, maybe we're going to add a low dose Anavar and you're going to do a TB5 and a BPC. We've also used Samorelin. Samorelin helps increase your IGF-1 score over time, which is like an arm of growth hormone. So that can help with healing. It takes longer to do. But again, I get so excited when I talk about these things because there's so many good things that come out of it when used properly, dosed properly. People can have great results. A lot of these things, like, we go back to testosterone replacement therapy is good for your brain, right? So it helps with that foggy brain. It helps with that mental strength. So going back to like people with PTSD, it can be very beneficial. Is it the one and done? Not necessarily, but I've had clients who have come in who have been told they're depressed or they're anxious or they're this or that. And they're like, but I don't think I'm depressed. They go on hormone replacement therapy and they're new people.
Really?
Because, and again, when your hormones are your basis, your foundation, right? So you don't build a house, starting with the roof, it would collapse. So if you fix your foundation and then you start looking at, do we add peptides too? You don't have to, but if someone's like, oh, I have a different goal now, or I'm having sleep issues still, then we're going to go down that avenue. Let's look at peptides. Let's see if we can correct.
What would you give for sleep and a peptide?
So we can use something called, we got a few of them. So Samorelin's supposed to help with sleep too.
Okay.
That's an injection. There are troches. Troches basically is sublingual, so you put it under your tongue. There's a blend of a Samorelin with a hexarelin. So the combination of the two, that really helps with sleep. I've done that one. CJC with Ipramorelin, that's an injection, usually 5 to 7 nights, helps with sleep. As you get older, you spend less time in REM. That's when you dream. You start taking some of these peptides. Sometimes I wake up and I'm like, wow, did I just live that, or is that
really
that sleep? Talk about journey. I wake up and I'm like, oh my God, like I just solved a problem.
So you have vivid dreams.
Yeah, pretty good. Sometimes a little too vivid, but yeah. So it's exciting because there are alternatives to just feeling like you just have to live a certain way and you're getting old and that's it.
Yeah.
We're getting old, but it's our choice as to how we age.
Yeah, 100%. And with the peptides, I mean, they're amino acids, so your body's naturally producing them anyway.
Right.
Correct. You just kind of maybe getting them in higher dosages.
Yeah, and they're just designed to be, they're a chain. I mean, I'd have to show you the book and stuff like that, but they show you the chains, like a little chain gang of the sequence of how they're done. But it's fascinating. But when you see things firsthand, I remember one guy coming in our office when it was almost 5 years. Well, it'd be a little over 5 years, but he had taken TB 500. He goes, it was like magic. He goes, I swear my scar was just going away, because it helps reduce scar tissue too.
Oh, really?
So, yeah.
Wow. That's incredible. And what about for fat loss?
So fat loss, yeah. So there are different options that we can offer. We have, again, we can look at peptides. We have a couple weight loss medications we can use. We also there are some cocktails of vitamins that we've used too. Like there's something called the lipo-amino mix. I just pulled a new one into the office because we offer in-office vitamin injections, but you can get the same stuff and do it at home.
Okay.
It has like some B vitamins, your B12, methionine, inositol, and choline, which is good for your liver, cellular repair, development. And it has levocarnitine in it, which is a fat burner. So sometimes doing that 2-3 times a week is great. We do NAD plus. NAD helps heal all organ systems in various forms, decrease inflammation, can help with kidneys, can help with your heart. Again, there's, dosing on that is important because if people take too much, then it feels like you're having a heart attack. So it's fine.
Yeah.
All of that. Yeah, we have, again, we have Arsenal. I don't use it often. I use phentermine in low doses. Can be a stimulant more for weight loss. Some people have used liraglutide, which is an injection every day. There's a microsema, which is an oral of weight loss. So we do have a few, and there's a few of the peptides that really promote some of the like fat breakdown and help with curbing the appetite and that sort of thing.
Okay. And I remember I took one last year, C-Max, which to me improved. I don't know why I stopped. My cognitive skills to me improved greatly. What are your thoughts on that peptide? Because it kind of blew me away.
Yeah, so we have C-Max and we have Selenk. So again, with cognitive function, and I apologize because I always get them mixed up, but one's also good for cognition, but anti-anxiety as well. I feel like I don't prescribe it enough. I feel like it's definitely something that we could push. One of the things we're going to be doing is coming out with bundles so people can try, do a Samoralin, and then they do do like a rotation of stuff. So they just keep benefiting their system. I just brought in some new supplements that are supposed to help with NMN, NAC, that sort of stuff. So it helps with, and then helping get rid of dead cells in your body and all that good stuff. So there's so much more coming down the pike. I just try to stay ahead and try to stay fresh because, when you've had people with you since you started, you got to throw them new treats.
Yeah. Yeah. I guess there's new treatments, kind of open it up and new peptides every day. In terms of that C-Max, now how does that actually function to make you cognitively, better? What is the mechanism there?
So with the C-Max, it's supposed to help, and I think that one's a nasal, if I recall.
Okay, I injected, but
you inject? Yeah, I'm gonna sound stupid here, but because I haven't prescribed it very often, I thought that one was more nasal, and maybe I'm getting confused with Selenk, but it's supposed to also help decrease the inflammation in the brain, and I just lost my train of thought. I think I'll wait.
Mini C-Max.
Oh my God. I just totally drew a mental blank. That's terrible.
We're talking about the mechanisms as to why it's functioning well.
Yeah. And I think people use them together too, the Selenk and C-Max.
That's always that.
I'll have to pull my papers on those. I'm literally drawing a blank. That's
not a problem. It happens. He's gonna start tonight with the C-Max.
Oh my God, I'll have to get back on that one for you.
Absolutely.
I tried to refresh everything before I got on the show. I was like, and there's always one you're gonna get me on.
No, there's I don't know how many you have to be so well versed on. So you are forgiven. I can't even imagine how many medications that you have to be familiar with these days.
Well, the other thing too is the pharmacies. We used to have maybe 2 or 3 pharmacies. Now I have 12 to 14 I use.
Really?
Yeah. So people would ask me, pricing. Now it's more like, all right, I know what pharmacy is coming from. I know what it does, except for C-Max apparently. And then can't remember costs. I always have to refer to my sheet. But again, it's just because we've just evolved that much, and that having to have all those resources because pharmacies or pharmacy laws are changing in individual states.
Okay.
So we always have to. I'm always trying to stay 2 steps ahead, so that recently, well, maybe not so recent, but I think it was this late spring, early summer, the state of Massachusetts Board of Pharmacy changed some of their regulations So that impacted some of the pharmacies because their pharmacist I don't know if it's a different license or a special license. So then all of a sudden, some of these pharmacies that we used readily couldn't ship into Mass anymore, special controls.
Okay.
So thankfully, we had other pharmacies that still ship 50 states, but it was like you've got all your clients from, say, Massachusetts in one pharmacy, and now you got to switch them all over.
Oh, it's amazing, all the regulations. I remember when they stopped, or they started again, I think, but like HCG.
Yeah.
I was getting notified by my compounding pharmacy that they were stopping that. I guess I don't know if it was DEA or FDA was cracking down on that, and then all of a sudden, it's no problem now again, right? Aren't they producing it, or something changed?
Well, you could get the commercial brand Pregnal.
Yep, that's what. Yeah. Okay.
Yeah, or we can get it, but it can't be compounded. And so you get the brand name, which obviously pricing went up.
Yep. Yeah. It's amazing. Just all these little regulations and their processes, the way they change constantly.
Yeah, we use the HCG is good. It helps with testicular function. But it's an injection. So again, going back to choices, we do have enclomiphene, which was like isomer of Clomid, which is actually better because it's an oral.
Yep.
So you don't have to worry about injecting. It hits both the luteinizing and the follicular stimulating hormones, so it helps with testicular function as well. It can increase your test levels, but it helps with sperm production. So, when we talk about TRT and guys are worried about, am I going to be infertile? I'm like, well, let me tell you, I've seen a lot of babies born, planned and unplanned in our office. Oops. So, we know that testicular function can decrease when you're taking testosterone. But then again, if your testosterone function's not there to begin with,
lesser two evils.
Exactly. So, enclomiphene was a good fit. And a lot of guys like it because, again, it helps with reducing or preventing the atrophy of the boys.
Yeah. You don't want that atrophying, that's for sure. Good down there should be atrophying.
My husband runs fast, so I don't know.
That's great. All right, so listen, just kind of walk us through the process now. Someone decides that they want to start TRT.
Okay.
What do? They call you guys, and how does this process work?
Yeah, so give our office a call. Can I say the phone numbers?
Yeah, absolutely.
Yeah. So our phone number is 603-232-9070. One of my well-trained staff would definitely, welcome your call, and they walk you through the process. But just to kind of review the process, we're looking to have labs done. Now, you can either come in with labs, if you've had your total T with your free T done, sex hormone binding globulin, estradiol, a PSA, that looks at your prostate. Complete blood count I like seeing because, again, of that increase of red blood cell production. I like to watch the hemoglobin hematocrit, see where we're starting from. Those are usually a good starting point. If you have those labs, then you call us. They'll have you email them over. We'll take just a quick review, and then we'd like them within the last year, preferably.
Okay.
And then we get you scheduled with me. Mentioning this podcast gets you $25 off your first visit fee. So that's a help. In the visit, and we're not expensive when compared to everybody else. We don't do contracts. We don't do membership fees. There's no monthly fees. I always tell people you pay for your labs or visit your product as you go, and we're not expensive. My first visit fee is $150, but again with 25 off, $125. Follow-up visits are usually $99. If you don't have labs, then there's a couple options that we can use. If you're close by, you'll be able to come into the office. We'll do a lab draw, get your labs done. So labs can run from like $99 to $185 if guys want the full set of labs, which looks at, your IGF-1 score, your A1C, kidney liver function. There's a couple other factors that are thrown in there. But usually guys 30 and up, I'm going to say unless you want that picture, just spend the $99, get those labs done. Once labs are done, then the appointment's scheduled. then what we do is then go over everything. We look at your labs. We talk about the pros and the cons, the different ways that you can take testosterone. Once we decide what's the best plan of action, then we're going to schedule your follow-up within 3 months. You're going to get labs done again, and then we're going to go over everything, make sure everything looks good. If you come back and things look great, then I'm seeing you once or twice a year.
Okay.
Some people like to be seen quarterly. That's perfectly fine. Some guys like to do that whether they're dialed in. Other guys have been on testosterone and might be transferring from another place. They've been on it for years. They're usually once, twice a year. So.
And then do you have like videos or, how do they know? You just like show them on video calls how to inject?
Yep. So we walk you through an injection. If you're coming in the office, then literally we're going to do that right in the office. We're going to walk you through. You're in the office. We're going to give you your first injection. Now, guys who are really petrified of the needle, I recommend I literally sit there and hold your hand, walk you right through it. And every person who's done the injection has said the same thing. Oh, that wasn't bad at all.
Yeah. Just so you guys know, I've done it for years. It is a piece of cake, guys. It's not difficult. It doesn't hurt. It's one of those things. Everyone's afraid of the unknown, and once you get over it, it's like, that was it.
Yeah. You're like, oh.
Yeah. What a punk.
Yeah. And then the medication itself ships from the pharmacy direct to your home. No refrigeration necessary. When you're running low, you call us for a refill. You can even go on the website, click on the requests. We try to keep it simple. I mean, I've literally done this thousands of times. Not that I want to, lose my neck, but so we streamlined it enough. People have an hour visit the first time, so that's plenty of time if you have questions. Some guys come in, they've been on it for, years, like I said. But again, there's usually something that they hadn't known. Because I like my clients to be educated. I don't want them to feel like, oh, what did I do that for? Because I've had people come from other offices. I'm like, do you know what? You don't want to make people feel stupid. Because they'll be like, oh, why were you taking that? And they're like, I don't know. And I'm like, all right, well, let me explain why they probably thought you needed it.
Yeah, exactly.
That approach. And they're like, oh, well, I don't need that.
Yeah, there's no stupid questions. And, hopefully you guys feel comfortable and, you listen to Judi speak like that. Like everything, there's nothing that cannot be spoken about and you guys shouldn't be embarrassed. We all go through the same exact stuff. So if there's anything that, you want to know, just ask. I guarantee everyone else wants to know the same thing. It's so funny. We're so embarrassed because we don't know, but you don't know until you know. And then when you know, it's going to answer a lot of questions. You're going to want to know why you're going through these things. You're going to want to know why you're on these medications. Then you can explain it to your other buddies when you're talking to them about your care. Because sure enough, as soon as you start feeling good, you're going to start talking to your boys about, you guys need to get on this. That's what happens with every one of us.
Oh, it's so funny because a couple of guys, they're kind of like, oh, my friend, all of a sudden, they're just like looking so good. And they're like, what are you doing? And so they tell them, and then the next thing you know, they're like, oh, I want some of the, I want it on that too.
Exactly. It's like the fountain of youth. It really is.
It is. And, and I know obviously men aren't the only ones with PTSD and then law enforcement veterans, women too. Women are on testosterone low dose. We don't need as much. But it's the hormone that drives us. It helps with, again, and I've said this before, your foggy brain, your mental strength, your physical strength. And I'm like, it's not about going to be the biggest person in the gym unless you want to be, but it's about driving yourself through, getting through your day and saying, hey, maybe I want to go for a walk, or maybe I want to go for a hike, or maybe I'm going to go to the gym. And then the next day, recovery. You feel good.
Yeah.
You're not sore. Or if you are, it's not like you missed 3 days. And then libido. Well, hey, you guys in your morning wood, and man,
that's how you know it's working well when you have that. And I don't know. I'm sorry.
I said, never realized how important that was.
Oh, trust. It's huge. And we all want to be virile guys, ready to roll. Listen, some marriages aren't, don't have too much going on in that respect. But if you want to be ready for when they do. And listen, a lot of marriages have died because of no intimate relations.
True.
And this is going to get these guys back in the game who are out of it. It's a physical issue. There's nothing wrong with you. You're just going through changes and you can correct them easily by doing this. I feel so bad. I look back 20, 30 years ago when this wasn't available, and you saw these guys like in their 50s and 60s, and they should still be living quality lives. But I can't even imagine, like, if this medicine wasn't around for me right now, like, how would I feel?
I know it's
Worst feeling.
it's crazy because, you know, I just when I was a kid, well, a teenager, and I'd be like, gee, why did Mr. and Mrs. Smith get divorced? You know, I always thought they were, you know, now when I'm in, you know, in my 50s, I mean, it's not a problem, but, you know, what if it were, you know?
Yeah. Exactly. It's a huge, listen, it's a huge issue. I mean, if you love someone, you want to be intimate with them, you want to be close to them, and this is part of it. And if you can't, I mean, especially as a man, I mean, it's affected everything, every facet of your life. So, you know, guys, if you're experiencing this, it's easily correctable. There's nothing wrong with you. Just, it's a medical issue. And like any other medical issue, you go to your doctor, get medicine for it if, you know, if it needs, and you take care of it. 1, 2, 3. Why should this be any different? There's nothing.
Well, that's what I'm saying too. Oftentimes you guys are getting Viagra. Well, if you don't have the desire, I'm sorry, but what's the do?
Exactly. Yep. It's ineffective in and of itself if there's no desire there.
Or if your estrogen's a little too high, it's not going to help.
And, you know, we were talking about PTSD. A lot of people attribute what they're going through to PTSD and other issues when, in fact, this is what's causing it. So it's like, what came first, the chicken or the egg? Is it the PTSD that caused this, or is it this that caused the PTSD? Or, you know, it's a mixture. It's a vicious cycle. But if you correct this one portion of it, a lot of times the rest kind of will work itself out.
Right. And again, not to, you know, there are people put on medications, and I'm not saying get off medications by all means, that's not it, but that can also be crashing the other side of the, you know, the other, making things worse in a different way, affecting your hormones, so that, and people wonder why do I need more medication? Why can't I do this? Why, you know, and then you look at people's labs, you know, that's the other thing, going back to those labs. You don't feel like doing anything, so you don't do anything. You know, physically active, you eat like crap. We got Gunner who's making his cameo appearance.
My husky was just shaking off here. I think she's gonna stop barking herself.
Yeah. So, you know, again, will it cure all the, you know, people with PTSD? Not necessarily, but it could definitely improve the situation. Yeah. So at least if people can't get out of that funk and say, why can't I just get to the next level? This might be enough to what you need. And, you know, so that's why it's so important.
Yeah. It's a huge piece of the puzzle sometimes, and one that's easily correctable. So start with this, and then, you know, you figure everything out after that. Put this first, because you know, essentially, this is going to be correctable. As soon as you get on this medication and get your levels to where they need to be, bam, that problem is corrected. And then let's see, you know, what we could do with everything else. But it's going to give you drive. It's going to give you energy. That fog clears up. That fog was bad, too. I remember, like, I'm feeling like this already in my mid-40s, but that stuff lifts very quickly.
It's true. I mean, for some guys, I've had guys come back, you know, obviously they come back 3 months later for their, you know, like they're doing well. And then they show up 6 months, 9 months, a year later, whatever, or coming in the office to pick up something. And you're like, who the heck is that? You know, it's like transformation.
Yep.
It's amazing. People look younger, you know. It's, you know, we laugh and say, fountain of youth. I always people, I'm going to be 80. No, okay. But like,
great.
Yeah. It just, and you feel good. Well, you're physically better. You know, you've seen people who come off medications, whether it's blood pressure medications, cholesterol medications, you know, people come off antidepressants. I always say, don't do your piece. Whoever's prescribing, work that out. I don't want them thinking that's why they're stopping, but do it safely. But it's nothing short of a miracle.
No.
But on the same token, people are going to do the work too, right? So if you get a testosterone injection and you're just sitting on the couch, your body's not going to transform. Now you get up, you go for your walks, you start walking. You know, your head's clear. Now you start going to the gym or whatever you like to do for physical activity. The rest just kind of falls into it. Then you start eating better.
That's
Yeah.
the biggest component as far as I'm concerned, that healthy diet. Because you could change your body composition, not even training if you're eating well. Consequently, you flip it around and you're training, but you're eating like garbage. You're not changing your body composition most times. You've seen guys in the gym year after year look exactly the same. Like, bro, what are you doing?
Right.
You know, I don't understand how you can keep going to the gym, not seeing any change, and keep doing what you're doing and not, realize something is not working right now. Let's get a trainer or a nutritionist or whatever the case may be. But
Yep.
just that sole component of eating well makes such a difference.
And you want to eat well, when you
Yeah.
go work out, like today I did a really great workout, a leg workout. Of course, I almost slapped an old lady. She was in my way, but that's terrible.
Stop a bitch.
Like, I got to go home and eat. But it's like I wasn't going to, I wouldn't necessarily, Gunnar got me good.
Drill?
Yeah, drool. He left his mark. But it's like somebody else might have said, "Oh, I'm gonna stop at McDonald's." I'm like, "No way! I'm going home and making myself a tuna, some tuna fish and some vegetables, and So
Exactly.
it's
Yeah, I tell guys, change the way you think about food. Like I think about it, is it going to build muscle, or is it going to be building fat, or it's just not going to be good for me? So if you kind of think about it as energy and fuel as opposed to, this thing that tastes great, which may make you eat like garbage, you just have to change the way you think about food.
true.
Yeah.
It's like, don't you basically eat so you can live versus live to, right? You don't want to live
Yep.
to eat.
Yep.
Like,
Exactly.
it's, you got to and you need that fuel, because if you don't have that fuel, but I find when you're on hormone therapy and your hormones are doing well, because you've got more energy, you find that you do want to eat, and you want to eat healthy.
Absolutely. And listen, if you're eating healthy 95% of the time, you can have that garbage every now and then, and it's not going to hurt you. And, it's good to throw that in every now and then. You don't want to get burnt out either. So if you're doing everything you should be doing 90% of the time, you that other 10 or that 5 and change, you could throw in garbage here and there, enjoy yourself, and there's no detrimental effects as well. So.
But it's funny because it's like what our garbage is going to be totally different than what somebody else's garbage is.
Oh yeah, absolutely.
Like what's my garbage? I guess if I had a pizza, that would be my garbage.
I love pizza. My thing right now is we have like Publix pizzas. I'll have my 97% red meat at night. Typically, I'll have it with English muffin, but lately been doing a Publix pizzas.
Oh yeah.
So I'll have a couple of slices of those with my just with the red meat. And I need to stop it, but man, it's a delicious meal. Holy crap. And then sugar. I should be in diabetic coma every day of my life. I love sweets.
Well, you get back right on track.
Exactly. So, no, I mean, I tighten it up. When it's time to go, I don't touch any garbage. So,
And that'll decrease inflammation too.
yeah, exactly. That's huge. I've noticed that big time, especially with my back. But, all right, listen, it's been fantastic speaking to you. Hopefully you guys and girls who watched have gotten a lot out of this, because Judi provided a lot of educational information. If you guys are feeling like we were describing, please just make that phone call, Cutting Edge TRT, and all the links are going to be in the bio as well. Judi gave you the phone number. One more time for the phone number, Judi, for those who didn't get the first time.
603-232-9070.
Nice. And guys, I hope you like what you saw. If you do, hit like and subscribe. Cutting Edge TRT to change your life, and we will see you soon. Judi, thank you once again. It was a pleasure having you on.
Yes, thanks so much. I enjoyed it.
Absolutely.